Well, hello there. Thanks everybody for being on with us today. I'm very excited about today's event. My name is Carson Heady, so I am the managing director for Microsoft Tech for Social Impact Americas. Um, 11 plus years with Microsoft, and actually had 5 years that I got to work with our star attraction for today, our chief digital transformation officer at Microsoft, John Barto. It's not lost on us that there are a lot of nuances, not only in the nonprofit space, but specifically in healthcare. And one of the things that we're going to talk to John about today is, he is privy to being able to work with some of the largest nonprofits that are, maybe far down the path on their digital transformation journey, but also startups and nonprofits. And so he has a lot of very unique learnings that he's had throughout that journey. And so we get an hour of his time today. So I definitely selfishly want to take advantage to learn. I met John about 6 years ago. We worked together in many different capacities, and he's become a friend and a mentor as well. So always appreciate the time that we get to spend with John. I'm joined as well by Kacie Shapiro, who is a data and AI specialist within Tech for Social Impact. She's supported hundreds of customers on their nonprofit journey as well. So buckle up. We're going to have a lot of learning today. I did want to mention as well, so the session is recorded. We will capture the recording, get that out after the fact. It's also, we don't want to be boring and formulaic. If you have questions, throw them in the chat. Happy to field those throughout. Make this interactive. Try to stump John, whatever is fun for you. But let's dive right in. John, I'd love for you to do a quick introduction of yourself and your role and kind of what you do in the day to day. And then I'll kick it to Kacie for the same. And then Kacie, if you want to ask the first question, we'll go from there. So, John.
Sure. So, Carson, I can't believe it's only been 6 years. It feels like it's been forever. But
My wife
um,
tells me that too. So,
it's like six years, 6 minutes underwater, the old joke, right? So yeah, my job at Microsoft is I'm what's called an industry advisor in the healthcare sector. I'm a former CIO from a hospital. I've experienced many things in the healthcare setting. I always tell people I'm a recovering CIO, which you can never really recover from that. My job's really to help healthcare organizations understand how advancing technologies can improve the things they're doing in healthcare and healthcare delivery, and also to help them improve their operational capabilities. I get to work with, as Carson said, some of the largest organizations in the world. And I also get to influence Microsoft's product roadmap sometimes because I go to customers, something's not quite right. We get to help them tune it, and I work with a bunch of partners in the space. The best part of the job is I get to see what's going on out there in the world of healthcare, and I can help you understand a little bit about that. And I get to, witness some of the best and brightest. So, Kacie, with that, I'll turn it to you Carson or Kacie. I'll give it to Kacie for a little intro, and then we can get started.
Thanks, John. And thanks so much, everyone, for being here again. As Carson mentioned, my name is Kacie Shapiro. I am an Azure data and AI specialist here with Tech for Social Impact. And something I've noticed is a lot of our customers overlap in the healthcare space. So trying to have more of these sessions just to really bring insights into what our customers should be thinking about and just some of the top of mind challenges that you all are facing and what we can do to resolve those. So John, really appreciative for you joining us and sharing some of your insights. And I've really kind of put together a list of questions with Carson on topics that are frequently coming up in customer meetings, and so that we can pick John's brain and get some expertise on things that our customers should really be thinking about in this space. So something frequently that comes up is that, especially in this current landscape, resource constraints are a huge challenge, and burnout amongst employees. So what could our customers be thinking about or doing in regards to this challenge?
Yeah, I think, and the challenge is only going to get worse because we're starting to experience what we call the silver tsunami, which means folks like me will find their way into retirement, at some point in the next 5 to 10 years. We're seeing 10,000 people retire a day, and that means two major things in healthcare. That means they need more care because they're toward the end of, the program of life, and that's usually when we need more care, but they're also exiting the workforce. And so, not only do we not have enough supply of workers for the healthcare industry right now, that's actually going to get worse, if you would, going forward. So the thing I always tell clients to focus on is how can we make those jobs much more satisfying to the folks that have to, be in them and much less administrative. So how can we use things like AI and those kinds of things to help them actually do their job and take away some of the administrative burdens that we've kind of saddled the industry with as we've digitized the industry over the few years, right? So the EMR has kind of enslaved a number of healthcare providers into the way they take notes and things like that. And one of the biggest use cases we're seeing right now in healthcare is the ability to do ambient listening and build notes and those types of things to take that burden away from the healthcare worker. So as much of that type of stuff as you can do, help automate the things like pre-auth and all that kind of stuff. Anything we can use AI for your data footprint against AI to help advance that will really drop the administrative burden and should make our employees much more productive and really reduce the burnout kind of construct. And that's what we've been focusing on quite a bit here at Microsoft is what enabling technologies can we do to create efficiencies in communications and the ability to drop that administrative burden.
I think that's a great
Awesome.
area to even stick for a moment, as far as what are some of the specific steps that you're seeing healthcare organizations take right now to examine how technology can empower them in this space, and then frankly
Yep.
what technology is capable of doing. You hit on something very important there, John, as far as alleviating the burden on healthcare professionals and improving job satisfaction. I mean, we know there's a lot of clinicians that are spending what's traditionally been called pajama time and doing a lot of
Yep.
their
Yep.
administrative work late at night. What are you seeing organizations explore in the way of tech to make these processes better?
Yeah. Well, first of all, there's starting to become a lot of products on the market in the tech space for things like ambient listening and those types of things. Microsoft has some, but many others have them as well. So I see people starting to dip their toe in the water because the doctors and nurses come to them and say, "Hey, I saw a friend of mine works with this, and I saw it, and I think it could really help me with my job," right? And then you start to see, I've actually experienced this. I found this fascinating. There's one healthcare institute where the doctors actually started purchasing those tools. They got approval from their health system to be able to use them, and they started buying those tools out of their own dollars, right, to actually change the way they were doing things. So I would suggest investigate some of that, but you got to get your workforce engaged in that conversation, right, and have them included. The thing that's fascinating to me is when we talk about um, AI in general and how it can affect healthcare, a lot of us get really enamored with these sophisticated clinical use cases that we can actually do eventually with the technology. But a lot of those are going to have to go through regulatory clearance and all that kind of stuff. And what I kind of always say is not all use cases for technology are the same. So focus on the ones that are crafting administrative burden that don't really require clearance, if you would, from a regulatory perspective. Things like prior auths, meeting notes, notations themselves, collaboration capabilities between individuals. Focus on those types of things because then you can drop the administrative burden for those professionals, make them more productive, and actually, make their job more satisfying, frankly, overall. Those are the things that I see.
I love that. And I will tell this audience, I made the move from enterprise healthcare at Microsoft into the nonprofit space for a very intentional reason. We take very seriously that often Microsoft is one of the biggest investments that you all make as a nonprofit organization and as a customer. And frankly, there are a lot of ways that we can unlock resources, and Microsoft invests in innovation. We've been very successful in the last several years in going out and finding ways to invest and fund your exploration as a customer of different potential outcomes that you can drive across these, and frankly setting up the infrastructure that's going to help you be successful. Even setting up like the ambient listening abilities, you've got to have the infrastructure to be able to do that, and we have the ability to bring in people and funds, and frankly technical architects at no additional cost to you to scope out these types of projects. So, definitely if we plant a seed today and something that sparks your interest, don't hesitate to reach out to me or anyone on your Microsoft account team so that we can be advocating for you. We invest in innovation, and we would love nothing more than to unlock some of those barriers and demystify Microsoft and how we can be more valuable to you.
Yeah, actually, to add to that, Carson, a little bit. Some of our most successful value cases for our clients have been when we brought them into a technology space we call the innovation hubs at
Yep.
Microsoft. And we've actually brought in, like, I'll give you a great example. We had a scenario where there was a a need to transition patients out of the emergency department into the inpatient setting much quicker. And we brought in the nurses on both sides, on the ED side and on the inpatient side. We brought in the administrative staff of how that functions. And we were able to drastically reduce the time it takes to do that by using technology. But it was because we put people in the room for a day or 2 days, and we started to kind of work through how's the process work. And if we put this tool in place, how would it work? And those are all investments Microsoft is willing to make. If you bring your people to that table, they're very willing to make that. That's where we see the biggest value cases coming most of the time.
That's great. Another thing that comes up pretty frequently is funding. Obviously, that can be a big challenge in this space. So what strategies can nonprofit healthcare providers implement to diversify their income streams and enhance, financial sustainability?
Yeah. So this is where I start to say, no matter what's happening in the healthcare industry or any industry these days, your number one asset's your data, right? If you can get your data contained and you can actually organize it so that you can use it and leverage it, there are ways to actually take that data, do de-identification, run it through AI algorithms, monetize it. You can actually sell it to others without risk of it being exposed. The other thing I'm starting to see, though, is I'm starting to see collaboration amongst various different entities to actually build better and better AI models. We have a capability at Microsoft that I'm starting to see leverage pretty heavily. It's called Confidential Computing Platform. And what we're doing is we're allowing multiple institutions. I have this going on in the pediatric hospital space, just as an example. We have multiple pediatrics hospitals that come to Microsoft and said, hey, there's not really good imaging models out there for pediatrics. So we'd like you, Microsoft, to build those. And instead of us building them, because it's not our data, it's their data, what we've done is we build foundational capabilities, and then we use this confidential computing capability for multiple different children's hospitals, pediatric settings, to use their data to train the models. So everybody gets a better model collectively. And then you can actually sell that capability and those types of things. It becomes your intellectual property in a space. That's one example. But it's really around getting your data marshaled, because with everything in the world, there's a marketing value, right? And if you've got your data well marshaled, well controlled, you can actually craft ways to make money out of that and actually reduce expenses and all those types of things. That's the number one hidden secret around AI is the data is the king. It's the fuel, and you've got to get your fuel in the right depots so that it's not attacked inappropriately and those types of things. And we're very focused on helping you secure that and get it organized and those types of things. So.
It's a very
Awesome.
astute comment and observation, John. One of the things that I think about in this space a lot, it's not lost on me. Our customers have a lot of options, and they can buy cloud anywhere. But I truly believe that Microsoft as a partner is a really differentiated partner in some of the value that we can bring. There's a lot of organizations, state and local government, communities that our healthcare providers and our nonprofit healthcare providers support and serve. And typically, they are also Microsoft customers. Furthermore, there are communities that I know we are privy to and that we build. I was recently having a conversation with a mutual friend of ours, Dr. David Rue, our Chief Medical Officer here at Microsoft. And I know that there's some communities even that our nonprofit customers are already parts of that will not only help them be exposed to different ways of thinking, but frankly, I would say elaborate on and embellish the value of that data. Because data is such a premium right now, there are real outcomes that are being unlocked thanks to research and data that our existing customers are doing. Talk to us a little bit about how could today's nonprofit healthcare customers be thinking about Microsoft as more of a partner in the healthcare space?
Yeah, I think what's interesting is, and I'm going to come at this from the angle of having been operating in a hospital environment, from the CIO perspective. Yesterday, in the old world, we bought a lot of packaged software from a lot of different partners. We deployed that. We find ways to integrate it. And our entire job was this treadmill of, buy a product, implement it, make sure it runs, operate it, upgrade it every so often. And, everything that was done through through the software vendors. And the dilemma I kind of have with that is that those software vendors are only accessing dollar pools for maintenance and upgrades that are focused in healthcare. And one of the beauties of if a cloud provider or a mega scaler like Microsoft, whether it's us or others, is that we actually bring the capability of innovation. The cost of innovation can be supported by every industry. And then what we do is we build on top of that capability adapters for healthcare. And so, we're very good at making sure that as AI advances, we bring you the latest AI capabilities. Like it's not just about models we built. The models you can build can be monetized in that platform, right? It's about getting the best tool in your hand. And that's the real thing that I think that the mega scalers can bring you that just basic players in this space that where you're deploying their platforms probably can't. Now, I will also say this. I think that there's a real strong value in what we call software as a service kind of solutions, because that does take a lot of administrative burden off the not-for-profit and all that kind of stuff. But don't do that at the risk of losing control of your data, right? If you sign into a SaaS agreement or a software as a service agreement, make sure that you have raw data capabilities coming out of that, because otherwise all the innovation that might happen is going to get throttled by that player that is that SaaS solution, that software as a service provider, and you're not going to have an ability to innovate differently. And I know it doesn't feel like it today, but I sense there's a future where, you know, competing for patients' attention, competing for the rare few dollars that are there for patients to get care, for people that want to stay healthy, that's going to become a competitive space. And I think that's going to happen because we're starting to see this mass consolidation of health systems growing bigger and bigger by merger acquisition. And I hate to say it, what they're doing is the profit side of the business is sucking all the profit out of that. In fact, we'll see it like in the rural hospital space. I'll use this as an example. We see rural hospitals closing down at a rapid clip and leaving people out in these rural communities with very little care options, right? The thing that's fascinating to me is as the reimbursement reduces for healthcare across the board, and we're seeing that, a lot of the for-profit businesses are either getting out or going bankrupt. I use Steward Health as a great example. Like there was a private equity came in, bought up a bunch of health systems, squeezed as much money as they could out of it, and then they basically abandoned that environment because they couldn't afford to run it anymore. And that leaves all that burden of care on not for profits and nonprofits. So I just really think that you need to get in control of your data no matter how you get it serviced. And look at a mega scaler like a Microsoft, because we can actually bring innovation dollars from every industry to focus on the healthcare problem. And we've built a lot of great adaptive capability inside of our platforms to make sure they function well with healthcare. In fact, that's one of the major reasons partners like Epic and others are choosing Microsoft as extensions to their environment, because we bring those capabilities. I think that answered the question, Carson, but I'm not sure.
It does. My goal in this is kind of cast a wide net of, how nonprofit healthcare organizations can look at Microsoft to enable and empower their mission in unique ways. I was talking to a nonprofit executive recently in the healthcare space, and their comment to me was, hey, more money, more mission. And we're actually looking at how can we, with our go-to-market and co-sell abilities, create an engine by which this organization, who has very unique data, to create these data offerings that reside in our cloud, and we incentivize our sales force to go out and sell this into
Yep.
the
Yep.
healthcare and the government space, right? And education and all the other constituents that you serve that we also serve. And so I think looking at these things in unique ways, looking at the value of your data, and then frankly, opening up some of these additional paths to commercial dollars so you can do more towards your mission. That's the way this is all going.
Yeah. Yeah, I think it's extremely valuable. I don't know if you've exposed, I think you have on LinkedIn that you recently have gone through one of our educational courses here at Microsoft. And I happen to be the professor of economics on those. I don't know how I ended up with that job, but people seem to think I do a really good job at it. And frankly, when you think about what's going on, the economics issues that we're seeing, and again, I use rural healthcare as the example. It's positioned us because Microsoft's mission is very specific about enabling every human to empower themselves using technology. We actually take that really to heart. And part of what we're doing in the rural care community, where there's this real issue with building an infrastructure that's secure and being able to manage it. So we're actually funding programs to make sure that there's a security aspect out there. Microsoft themselves is working with others to, fund those types of programs. So look into those types of things. And we're looking for creative ways to use assets at our disposal to make sure that we ensure everyone gets the capabilities of care and those types of things that they need by leveraging technology the best we can. We've done a lot of distance kind of stuff in those rural communities. We're working with some players that are building what they call healthcare utilities. This is to do things like drugs that are too expensive. They're building a utility amongst multiple health systems to build those drugs and distribute them. There's all kinds of things we're investing in, investing our time, investing our money, investing our technology into help in that space.
It's another great differentiator of Microsoft, frankly, as well. I mean, it starts at the top. I think Satya and Nadella, our CEOs, acknowledgement and understanding and embracing of the fact that, AI and data are going to be so commercialized and democratized that we want to make sure it's done ethically. And right now, there's a real opportunity for us as an organization to invest in the AI skilling and capabilities of the customers that we support. This is a real opportunity for us to be a direct conduit to resources that we can bring to our nonprofits and our healthcare organizations that we serve, to help improve your operations in any way that we can, from what you're doing internally and internal operations and optimizing processes to population health and how you engage and educate the communities that you serve.
Yeah, I'd add to that is I don't know if you've exposed train. I mean, you talked about Dr. Rue earlier. So one of the things that he sponsored from our CMO's office is this thing we call TRAIN. It's trustworthy and responsible computing, and it's really around how to use AI in healthcare in a responsible way. And what it is it's a group of organizations from healthcare that have actually been brought together to actually focus on how AI will be marshaled and governed, and they're actually teaching some of our regulatory bodies and those types of things in that space. So it's just another way we invest in making sure that what we bring you is secure but valuable, and that we can help, do the right things going forward in the space.
Yeah, and you've touched on it a little bit, but we're in really interesting times right now, just politically and just with rapid change in technology. So, how would you describe the current economic landscape of healthcare, and how do you see it really shifting over the next 2, 3 years?
I always use
Or
one word. I always use one word to talk about the current condition of healthcare. It's unsustainable. It is not
Mm-hmm.
sustainable in the form and fashion we have it. It's capitalism has played a big part in healthcare in the United States. We're the only country in the world that has developed healthcare in the way we have and had it funded on the backs of the employers and those types of things. The problem is that it used to be that if Carson joined a company, now Carson's probably not the right example because he's been here for a long time, but if he joined a company back in 50 years ago, he would stay with that company pretty much all his life, right? And if there was a proactive investment to be made in Carson's health that would pay off in 10, 15 years, the employer-based care system that was managing his care would be well incented to do that, right? But on average now, people move jobs every 4 years, right? So if I move from employer A to employer B, and employer A is investing in something that keeps me well, 10 years from now, employer B is actually grabbing the benefit of it. It's really reduced the incentives for employers to engage in some of the proactive natures, if you would, of healthcare. And it's caused some real concern. And we've started to see the industry move to this thing we call value-based care. So it's really about paying for results, not just for performing procedures, performing care incidences. And we're starting to see some mileage out of that. We're starting to see some refined measurements of quality and those types of things to apply against that. Because we had what we would call value-based care a few years ago. It was called an HMO. Probably a lot of people on this call don't like that word HMO because it had its negative connotations because there was this feeling that HMOs would take your money for proactive care and then never provide care because that's the way they were making money. The quality metrics allow us to do better jobs in these accountable models. I think the real problem, Kacie, is humans themselves are the only people that can control their care, right? Like I could tell you, if I was your doctor, I could tell you to do anything, Kacie, and it's up to you whether you do it or not. So we've got to find a way to shape the minds of the folks that are needing care going forward to stay healthier, because that is the best possible way of actually reducing the cost of healthcare over time and improving the quality of life. We've got to find ways to do that. And I know that's tough when you're like in a non-for-profit space, because usually what you end up with, unfortunately, is those that are of a different behavior status, right? They haven't been taken care of. They've got this hierarchy of needs. They don't have the money they need to actually buy transportation to see a doctor. They don't have the ability to buy their drugs that stay on them, those types of things. So it's a little difficult in our world, but we've got to really help culturally shift that mindset, frankly. And there's starting to become incentive models that focus on that, but man, we're going to see a mass consolidation in care providers in the United States. I suggest there's going to be a big sweeping change there. I mean, it's not that we haven't been seeing it, but I think we're going to see more of it. I always thought the limiting factor in a lot of that was the DOJ approving things. And if you think about the political environment now, I think there's an ability to get things approved that you may not have gotten approved in the past. But I also know that a lot of it actually lives in the hearts and minds of the people on the boards of these institutes. And what board seats are available when we merge or when we get acquired. And that's an asset that's, kind of has been the limiting asset, but I'm starting to see a reduction in that kind of mentality. I'm starting to see people think, I can't afford to run this business separately anymore. Let's merge it together. And I think it's really kind of interesting from an economics perspective, what's happening to the industry. But right now, I'll tell you how unsustainable it is. My wife and I discuss retirement, not that we're getting there anytime soon. And we talk about where we want to live in retirement. And I'll tell you, the biggest thing we talk about is where can we be provisioned health care at a reasonable cost out of the dollars we have to spend in retirement. And I hate to say it, the US does not rank high on that list. So it's just to give you a dire feeling about like where we're at from an industry perspective, in my opinion.
Yeah, you're right too. It's challenging for those that do have access. And so just for those, less fortunate, it's even more of a challenge. So how do we move towards a more sustainable future?
Well, it's interesting. I got influenced pretty recently from a customer. I won't name who they are. That's pretty progressive in the space, and their message is we need to just change the entire model. And like young healthies, I'll call them young healthies, right? We all know that as you age, you're more likely to need care and all that kind of stuff. Why do they need to see a doctor every year? Like, why can't they use some AI capabilities to know when they're going down a trail that's not effective and be steered a little bit from there? Maybe we only need to see them every 3 to 5 years, right? Because if you think about the number of appointments that are open, the access problem, right? If you think about that, we're not going to be able to have access for all these people that are getting old that really do need access to care and the young people, like the young healthies. We've got to change the program a little bit. A lot of times we would have them come in for an appointment just so that I could bill for that event, because it was a pay for performance kind of thing. If they needed drugs, I had them come in. I'm not saying that we shouldn't be seeing them every so often if we have them on a drug protocol, but there's probably readings we could be taking off blood pressure cuffs or, all the blood, we could be doing lab tests without a consult and basically find the values in there that tell us that they need care. We probably need to repattern when someone particularly goes to primary care. Because the gate right now is to get to a specialist, you go through a primary care professional. Well, we don't have enough primary care professionals to
Right.
even use that as a gate. So if we could find that somebody needs specialty care and provision them directly there and get that done, we could take some of the burden off the primary care. We would unlock the ability for them to go get care that they may be sitting for a month waiting on a primary care physician appointment only to put a referral in to go to a specialist, right? We got to rethink some of that stuff if we're going to make this sustainable going forward.
I mean,
Just some opinions there.
yeah, of course. I love
Makes
it.
a
Well,
lot
I,
of sense.
I will say every prediction that you made when we used to do these shows in the healthcare channel right around the pandemic time, all those predictions came true. So you're usually pretty good in the way of prognosticating, John. Um, we're talking healthcare. I think we'd be remiss not to touch on regulation, right? There's obviously a lot of nuances in that space. How can healthcare organizations right now strike the right balance between protecting patients and
Yep.
also enabling innovation that is much needed?
Yeah, I think healthcare organizations can help teach our regulatory bodies. I think that's probably the most important thing you can do. And I'll give you a great example. I'll use medical imaging as an example because I do a lot of work in the medical imaging space. As a country, we struggle to get new AI algorithms through regulatory effects so that we can actually assist a radiologist, a cardiologist, a pathologist, an analogist. Let's just call them analogist. Um, by able to take that pixel data, run it through an algorithm, and send them indications that, hey, you should look over here, you should look over here. There might be something right here. I think I found this. We struggle to get those regulatory aspects, mostly because I believe, first of all, regulatory bodies are understaffed, right? You got to think about things like the FDA. Historically, their role was to go make sure that if you're canning tomatoes, that your canning plant is like clean and all that kind of stuff. Now you put them all the way over in this world of regulating what's going on in healthcare, and there's a lot of education we need to provide them. And I will tell you, significant education comes from Microsoft. We have a gentleman on our team who's written about AI in healthcare. His name's Peter Lee. He used to run our healthcare organization. He runs our research organization now. And I remember spending time with Peter where he's like, "Well, I've got to go talk to the FDA," right? And he did that almost weekly, if not more often. So we all have a mission to make sure our regulators feel comfortable with the capabilities, but we've got to do that rapidly. And here's the example I wanted to use. If you look at the difference between the United States and Australia, in Australia, and I've heard the statistic, I haven't validated it completely, but about 16% of all reads of radiology images in Australia are done from an AI perspective. No human touches it. And it's because they didn't have enough radiologists, frankly, to manage all the reads, and they were able to get more comfortable with AI and the algorithms and the models quicker than we've been able to from a regulatory perspective in the United States. We need to advocate for speed at that. Now, I don't want to lose the safety side of it. Don't misread me. We've got to advocate for speed of that, and the best way we can do that is educate folks in that space, right? It's a big education process for all of us. That's why we started things like Train that I talked about earlier. It's really pulling these communities together to help educate folks on what's possible, what's scary, what should we stay away from, how do we protect each other in this thing? It's a community effort.
Makes a lot of sense. Switching gears a little bit, this topic comes up probably not only amongst healthcare customers, but I would say all of our nonprofit customers. But what could happen if, nonprofit healthcare organizations don't move quickly to really modernize their data and start taking advantage of some of these technologies around AI and things of that nature?
Yeah, as much as I'm somber on the future of healthcare in the United States, I do think there is going to be a competitive nature to it. I think we're going to see these mass consolidations of health systems. Again, I've seen it when I first came up, when I was the CIO, there were 6,800 operators in the United States. When I say operators, there were major players that owned health delivery systems, right? They might have had 10 hospitals, they might have had 100 hospitals, but there were 6,800. That number is well under 4,000 now. And that's been quite a distance period of time, but I would tell you a massive part of that consolidation has happened in the last 5 years. And I think we're going to see it only ramp up to the point we're going to get to these mega scale health delivery systems that are going to be competing for patients. They're going to be competing for the most profitable patients, right? The people that they can get the best billing rates for, the people that they can control the disease so they can, under an accountable care model, make the most, separation on it. We're going to see that, and it's going to put pressure on the nonprofits because they're going to have to compete for those patients, for that attention. Otherwise, they'll be left with, and I hate to say this, the have-nots, right? There's going to be have and have-nots, and the have-nots are not going to have funding, and it's going to get very difficult in a nonprofit world to be able to deliver care at the cost structures that you're going to be given from a reimbursement perspective. If you don't figure out how to use your data to co-compete for some of those other people that are going to be able to augment it. So a lot of when you look at health plans, there's this actuarial model where they put healthies and unhealthies in the same actuarial pool. And really what's going on is while they collect dollars for insurance, they're basically taking the healthy's dollars and kind of reprovision it to the cost of managing the unhealthy. And there's now regulations around how that pool has to exist. Um, I'm concerned for nonprofits being the people that are going to have to pick up the burden on the lower end of healthcare, and it's going to put much more stress, frankly, on your organizations if you don't get organized in your data models.
Yeah.
And compete for some of those other, maybe more, I always say profitable. It's not profitable, but more valuable clients because there's a separation between what you spend on them, what you get for them. And you can use that. You've said more mission, more money, more mission, Carson. So you can use that more money to expand your mission.
So for our customers just kind of starting down this journey or down towards this digital transformation, what's something, what's kind of an initial step that they should start thinking about, would you say?
Yeah, I if I were going to focus in this space, I would start organizing my data around patient engagement, like around how do I make it convenient for someone to use my services versus other services? How do I take all the administrative burden out on both sides, both on my delivery side and on my receiving side, right? To do that kind of stuff. How do I become that player that just show, I have a need. Oh, I think of this nonprofit organization because I've had some experience there before, or someone else that posts on social media says, "Hey, I had a great experience at nonprofit organization X." And don't fool yourself. That's the way a lot of referrals happen nowadays, right? And Carson's probably the biggest advocate of that. He's got the largest LinkedIn group I've ever met in my life, right? So, that's how referrals happen nowadays is others come and say good things on some posting site that this was a great experience. Make sure you're producing those great experiences for your patients. It'll also create great experiences for your care providers, the people that are servicing them. And when you do that out of the data footprint, you're going to start to see that you'll capture some of those interests and just program it into their daily lives. Make your brand the brand that they think of when they want something, right? I don't know specifically how to tell you exactly how to do that, but the data footprint will guide you where you need to go to do those types of things.
I like that. What, John, as you think about like where are you seeing technology and even frankly Microsoft bridge the care gap for some of the underserved populations, specifically in rural health. Where is technology changing the game already, and where should organizations be thinking about leveraging tech where they haven't before?
Yeah, so there's some distance one of the first response I'll give you on that is behavioral health over telecommunications platforms is huge. Like we are well underserved in the US, more so than any other country in the behavioral health space. And that is a great candidate to use virtual platforms to actually deliver behavioral health. Um, think about that. There's even tooling out there now. One of our partners, Canary Speech, can actually sit into a conversation and they can actually fill out a form that you can bill for that says here's where we're at from a mental health behavioral health perspective. It's actually got a CPT code associated with it, and it can get that just out of the biomarkers of your voice. It's an early indication of someone requiring behavioral health being done over recording off of a Teams event or a teletransportation. But I suggest that number one, behavioral health can be serviced over, a virtual platform, probably better than most other pieces of healthcare. That's probably number one. Number two, find ways to enable those systems. And I'll go back to the rural setting. Let's find ways to offer services from, the central healthcare capabilities. A great example here is I'm working with an institute that's built this distribution capability of being able to distribute neurologists and things like that electronically to, rural settings. They actually have facilities where they'll bring people in there once a week, and then your patients on a rural setting can come and visit them, right? Start thinking about that. How do I pull those valuable resources out of the central pool to actually service that rural community through these kind of service networks, right? And we're starting to see a lot more of that go on from a community build perspective amongst health systems. But the data is the key so that you don't slip through the cracks of, services that you're being provided and rendered, right? The other thing is there's lots of programs out there. Um, like one of the things that's recent is some of the latest regulations have really kind of stiffened up the modeling around dual eligibles, people that are both Medicare and Medicaid. There could be a huge advantage there for you as a nonprofit to be able to um, go through the qualification because that requires community build around these folks. But there's some good monies there to be had on actually delivering care to those environments. So look at some of those opportunities because that's one of the programs the NIH is probably not likely to shut down. They have been shutting down some of their programs, but some of the recent rulings provide you some advantage in those dual eligibles and things like that. I'd look to those, but anything you can distribute, reuse central resources to distribute care, things like virtual sitting, things like nurses that come over a wire, things like putting technology in homes and using a hospital at home kind of function, or just a monitoring after exit of the health system kind of function. There's all kinds of things we can do in that space that will allow us to maybe get back out to the touch and feel of the doctor showing up at the house. Now, I know your generation, and I'm going to say your generation because I'm a little older than both of you, probably don't remember the days when the doctor made a house call, right? But that was a much closer environment. Think about it, if you're making a house call, if you're a doctor, you see so much more to help you evaluate that patient. You get social determinants kind of information. You can find out what's going on in their environment. You can do that over a virtual facility, right? We've seen that. People aren't as good about cleaning the house right before the care provider shows up if they're doing it on a virtual world. So you can already see that in the background there's things going on. That's why I use a dark background so you don't see anything. Um, anyhow, but there's lots of capabilities in that space that we can leverage. Um, Again, I don't have a recipe book for you. I'm willing to work on it with you, but I don't have a recipe book for it. Your data will lead you there.
That's great. No, I think that's super helpful and things to think about. But another question that comes up a lot is AI and how to start adopting AI, especially with all the regulations and everything in place in this space. So how can customers kind of start to think about that in terms of, regular
Yep.
the guidance that they need?
Yep. Well, first of all, my suggestion is try it out. Like there's a lot of people talking about AI. There's not a lot of people actually trying it out. Now, when I say try it out, I say try it out in a safe scenario, right? So I'll give you a great example. We offer a capability inside of Azure to allow you to securely put your data in an envelope and actually use AI against it. And we guarantee using through HIPAA regulations and all that kind of stuff, we provide you all the controls you need to make sure it's compliant to what you would need from a healthcare perspective. So you can feel safe about it. Um, I'd say go use that. Now, I'm going to tell you that if you're not using some of that stuff and trying it, your employees are bringing it to work, right? They're bringing it to work. They're just doing it in a scenario that could put you at much higher risk than if you actually centralized it and gave them the capability to use it, right? There's other ways to actually start to use the technology. We've been working really hard at building these things. You might have heard Copilot come out of, anybody's mouth you've talked to at Microsoft, and we've got lots of these things called Copilots, which is taking technology you currently use from us and actually embedding AI in it and making the use cases so much easier through this thing we call Copilot. That's another great way to try it out. But don't shy away from it. Try it out and give it a little bit of space, right? My first couple experiences with AI, yeah, they weren't so great, right? I used those same prompts, which is one of the things we talk about in AI. I used those same prompts, frankly, 3, 4 weeks later, and the experience was awesome. This thing is changing. These things are changing so rapidly. So don't take whatever happened to you at a point in time as the experience you're going to have from here on out, right? Like, and I would suggest try that. Like, go try a few things with it. If it doesn't give you quite the results, save whatever you ask it and go back and ask it in another month or 2 or 3. And you're going to find some huge performance changes. One of the best examples I have is I tried to build a PowerPoint presentation from a piece of documentation in front of a live audience. And when I first did it, it kind of choked on it. And I went back to that same conference the next year. But I got it to work because what I did is I used Word to summarize the document in a way that I could put it in PowerPoint and make it work, right? I went back to that same conference a year later. I ran the exact same prompt off exactly the same piece of documentation, and everybody was in awe at the level of sophistication that presentation came out, right? So try it a second time or a third time and store your things that didn't quite work well and try them again a little later because it is changing. So first and foremost, make sure you protect your data, get it to a place where people are using AI you know is trustworthy. And entice them to try it out. Educate your employees. Like one of the biggest things we don't do is give a full education program on, how to use AI, what's the value of it, when to use it, where to use it, how to be creative with it, right? Like, one of the things that's funny, I was at One Health System. It was actually a workers' comp model. And they brought me in for 2 days, and I was talking to the CEO and his team, and we had this board meeting coming up. So I was going to be with that board for an hour. And every time I turn around, from the day I walked in there, ask me, what use cases should we be running with AI, right? That's what everybody always asks. And I said, I don't do that. I said, you need to learn how to use the AI. And then the use cases are within you. You already know them, right? You just got to learn what the capabilities are of the AI and you'll get there. And I kept doing that for, the 2 days. And we come up to this hour at the board meeting and the CEO, just because he was being a little bit pushy on me, it says right in front of the board, well, the first thing I want to ask John is what use cases should we use this on? I just looked at him and laughed. I said, I told you over the last 2 days I don't do that. But I said, I'm going to take a risk here. I'm going to do one use case for you. And I said, this is a risk because I haven't tried this yet. And I said, I'm going to do it in front of your board. So all I did is I sat down with Bing Copilot, right? At the time, it was in early stages of it. And I said, if I were this corporation, What should I be using AI to do to improve my business? And it came back with this like pretty document and report. And the chair of the board turned around and looked at the CEO and said, "Didn't we just pay that big consulting firm $450,000? And like the result we got's not even as good as that." And
Wow.
and I use that as an example of the use cases are within you, right? Like if you know how to ask a question, you know how to use this technology. But just make sure it's safe. Make sure what you're offering your employees is something you feel comfortable with from a safety perspective. We put all the guarantees, or I wouldn't say guarantees, we put all the controls in place so that you can stay safe, right? We'll show you how to operate those controls because, compliance in general is something that's a mutual event. We have to do things, you have to do things. We'll provide you the controls you need, show you how to use them so you know you're safe in that environment.
Yeah, you make a really good point. Skilling is so important just for everybody right
Yeah.
now. And it's a new muscle. So you just have to keep working at it. But the more you do, the, better it's going to be. So
It's like
yeah, great
training a
point.
new employee, basically. It
Yeah.
is like training a new employee. Like they go back after a period of time, that whole thing I told you about, I went back a year later. Think about as an employee comes on board, if I'm assuming most of you have employees that work for you, right? Or you understand this process. When you first get them into your environment, you tell them to do things and you watch very tightly because you don't know if they're going to do them the way you want them to do them or not. But over time, you learn to trust them, right? Over time, they adapt, they do something you're used to, you trust them. That's the same kind of capability that starts to happen with AI when you use it frequently. If you're an infrequent user, you'll probably never get there. You'll always be suspicious of it.
Absolutely.
Outstanding. I know we are coming close to time and would love to open it up again if anybody wants to throw a question into the Q&A. Also, obviously, feel free to reach out if you've got any questions after the fact. Looks like we have a question. So, in terms of the importance of controlling your data, what would you suggest for nonprofits that support government programs that require patient data to be managed in their EHR systems and data is only available through reports?
Yep.
Great
Yep.
question.
That is an awesome question. And when you have scenarios like that, obviously you need to comply to what's required. The other thing I would tell you is that these EHR systems are partners with us. They're starting to embed a lot of the AI inside of there. Um, you know, I can't say extract the data footprint because, from a regulatory perspective, you need to manage it where they tell you have to manage it. I get that. But then push on on the HR vendor to actually tell them examples of things you want to do with AI. Push on them. Become really deeply engaged with them. If you can't get that data footprint out of there, if that's the only place you can use it, then push on them to help you provide those services. And I will tell you, some of the largest EHR providers in the world are working with us on how do they embed these capabilities, much like we did with Copilot, embedding AI and capabilities you get from Microsoft as package type softwares. Do the same thing with those folks. Push them for what you want. You pay them, push them. Right? I always, I always love that. Like people come to me and go, "Can you help me with this EHR company?" Well, you pay them, they pay me. I can help you get brave enough to go tell them what you need because you're paying them, you're paying them for those services. I can help you get brave enough and feel confident to go do it, but it's going to be upon you to have to go make that call to say, I need more from you for the dollars I'm providing you.
It looks like we have another question too. At Microsoft, is the answer to maintaining access to the raw information without getting tied to a platform to aid our own product strategies, the Azure AI Foundry service, where us organizations maintain the training data separate from the model, or is there some other product solutions available?
What our basic belief at Microsoft is that we try to support open standards as much as possible, right? The reason for that is if you're doing that, that gives people accessibility to innovate on top of it. It's very difficult in healthcare because everybody takes standards and kind of tweaks them for their own good, particularly the software vendors that are providing you functionality, and they do it for good reasons. Don't misread me, but if we get outside those standards, it's very difficult. Our job at Microsoft is to bring you all the tooling possible, the best tooling possible. It might be that we have 10 models that could do whatever you need. What we want to do is help you figure out which model is optimized best for what you want to do from a cost perspective, from a performance perspective, best utilization. It's not our job to produce all those models. It's not our job to lock you into intellectual property for Microsoft. It's to provide you the place that you can go get all that stuff. That's one of the things we're trying to do with AI Foundry, is to basically bring some of the best models. If you look in Foundry, and again, I'll use the imaging side of the business as an example. We've got 3 models out there we've put out there. There's hundreds of models out there now, right? Some of them come from our largest partners. Like if you're going to do pathology, Page has put their models out there, right? And it's our job to kind of make sure there's a place for you to go get the best in a secure fashion with your data. It's not our job to always be the players that are producing that. It doesn't have to be our model. Like, if you look at it, we're very tightly partnered with some of the model leaders in the world, right? And that's what we focus on, is making sure you get the best. But we want to make sure it's in a secure environment. That's what we're trying to do for you. And then we want your data to get in as pure a form as possible from a standards perspective. In fact, this might be a little controversial, but if you think about what an EMR does or an EHR does, eventually it structures data. If I had the raw source of that data as it was being generated, I could change that structure over time using AI to morph it into more valuable cases. So, I think EMRs and EHRs are going to change over time, candidly, because they're going to recognize that that the structure you inputted in may not be the structure you need it to be in the future. You just need the raw data so that you can actually structure it to its best need in the future. I think you're going to see some of that kind of movement. Hopefully that
Awesome.
helped with the answer.
Yes, thank you, John. I know we're about at time here, so just wanted to thank you again so much for joining us and giving us all of your valuable insights to a lot of these questions. It looks like, oh, okay. We hope to do more of these with TSI and just bringing the expertise from our healthcare side and the collaboration. So thank you all so much for joining. We'll follow up, but if there are follow-up questions, please reach out to me, Carson, your account executive. We're happy to get the answers for you, and we'll send out the recording to everybody. So thanks so much.
Thank you for having me. I appreciate it. It's been great. Talk to you all
Thanks,
later.
everyone.
Bye.
Yes, thanks, John. Bye.